morning, my colleague. I am Dr. Afrah Adnan Khalid. I have PhD in oral maxillofacial pathology and I work as a lecturer in Department of Oral Diagnosis, College of Dentistry in University of Al-Anbar. And I am glad to be here with you sharing my article that was entitled Using of Diode Laser 940 nanometer in Orofacial region. Introduction. Many specialties in medicine and surgery are interested in the progress of the biomedical applications of the laser. Laser is an effective and praised device in all branches of dentistry, including oral and maxillofacial pathology. Diode lasers are emitting light in spectrum of visible red region to near infrared region, and they are quite different from other kinds of lasers in both bumping mechanism and operating performance. Lasers have been played an integrative role in practicing of maxillofacial surgery much more than other specialty in dentistry, in turn become a standard tool for care providing in orofacial region. Lasers offering advantages of precision, hemostasis, less edema, elimination of bacteremia, minimum post-operative pain, improved infection control, excellent scope of visibility, avoidance of tissue shrinkage and tissue trauma, reduced scarring, less instrument at operating site, and tumor seeding prevention. Materials and methods. This clinical trial was conducted in our private clinic using Biolase EPIC X 940 nanometer in many orofacial clinical applications. 35 patients, 10 female, about 42%, and 20 male, about 57%, and the age was ranged from 3 to 58 years old. The questionnaire sheet and instruction were written, discussed, and constructed to both patients and parents. And the informed consent was also signed. Then the patients were clinically evaluated and prepared for surgical procedure. The demographical information regarding patient's age, sex, occupation, clinical presentation, dental medical history, and address were obtained and recorded. Viral screen was requested concerning hepatitis B antigens, hepatitis C virus, and human immunodeficiency virus. The surgical procedures were carried out under topical anesthesia by using xylocaine spray 10% from suet, and in certain few cases by using lidocaine injection 2% from streptodent France. At the end of the surgery, verbal instructions were given that including avoiding citrus, spicy, hot, and vigorous food for the few days, as well as following instructions of soft diet and meticulous oral hygiene practice. Oral analgesics were prescribed on need during the post-operative period. All patients were followed up at 3 days, 1, 2, 3, and 4 weeks after surgery to evaluate and reveal opinion about bleeding, edema, pain, functions, and total calcification. Results. 35 cases were included in this study. The clinical presentation of these cases were 2 in facial nevus, another 2 for melanine depigmentation, 5 cases for gingival fibromatosis, 4 for fibroma, 5 cases for tongue tie, and 1 case for fibrolipoma of the lower lip, implant insertion and exposure in 6 cases, gingivectomy for two cases, and tooth whitening 2 cases also, and another 6 cases for teeth troughing, with different duration, mood, and power according to the type of the tissue and the depth of the tissue we will need to extract. Let's go to see the cases presentation. Gingival fibromatosis In this case, we can see there is thick gingival fibromatosis overlying the first central incisor, and we will remove by using diode laser this gingival fibromatosis and allow the tooth to be erect. Another case for fibrolipoma of the lower lip. Another case for tongue tie. In the first picture, we can see there is limited in the movement of the tongue, and the last picture we can see there is a free movement of the tongue. Implant exposure and insertion. Another case for facial navels and the melanin depigmentation. Conclusions. All patients reveal total satisfaction and well acceptance with laser surgical procedures as minimally invasive procedure. Laser, very effective and usable alternative device in removing and diluting various soft tissue pathological lesions with better repair and healing process. This article was published in Journal of Research in Medical and Dental Sciences in 2017. Thank you for giving me your attention.